Welcome, bem-vindos, bienvenidos to this session. I'm very proud to have a very good set of panelists here with us today. Plus, I'm seeing that we are increasing the number of participants. Now we are reaching almost 400. So thanks a lot for joining. And welcome to the session 5 of the course Scaling Up Health Adaptation Measures to Meet the Climate Change Challenge in the Americas. This session 5 is dedicated to listen and learn, share your experience with scaling up health adaptation. So as the name implies, you are invited also to participate in this session. So we are having the chat open for your comments and questions and also the Q&A. But to start with, first things first, my name is Daniel Bus. I'm the Unit Chief on Climate Change and Environmental Determinants of Health at the Pan American Health Organization based in Washington, D.C. We do work with the topic of climate change and health, water sanitation and hygiene, chemical safety, air pollution, and other environmental health topics in the Americas. And we are very proud to be part of this course with so many other important institutions in the Americas. As you can see now on my screen, interpretation is available. Please find the button of interpretation, well, depending on the top or in the bottom of your screen, depending on which system you're using. Then you can find this button. Interpretation is available in 4 languages. So please feel free to choose the language that you feel more comfortable. As I was mentioning, we are on session 5, so we went through almost half of the course by now. So thanks a lot for joining us and for being part of this incredible group of people of the region of the Americas and elsewhere in the world that are participating in this course. I had a pleasure to participate as well in session 1, and now we are on session 5. Of course, I won't read it all, but just to remind you of the course objectives, this is all in the materials that Maggie and the amazing GCCHE team shared with you. Also, we have these learning objectives of our session today, which is going to be identify common challenges and solutions. And that's why we want you to participate as much as possible as well to be part of the contribute to collective knowledge about effective approaches to health adaptation, scaling up. So let's see what we can get from our amazing group of panelists today. About the logistics, so this is 1 hour and a half. We'll have some question and answers at the end after the presentation of our panelists. And we have also a round of discussions, a roundtable for discussions. So please feel free and please use that space of questions and answers, preguntas y respuestas in your system and also the chat. So we can use those questions, and this can be more a dialogue than a presentation, listeners only. The sessions, the video recordings of all that, all these slides and presentations and other resources will be available for you, of course, as we always do. This is just a reminder that you don't have to do anything to record your attendance. If you joined using your Zoom link, your presence is already automatically recorded, and the certification of participation will be given if you participate in 8 or more of these live Zoom sessions and pass in the final exam. So with that, we invite you all to join the WhatsApp group that is going on in many languages. Please feel free to join and participate more actively in that space as well. So fantastic. We're approaching 600 persons, more or less. And we have a very exciting group of panelists today. I'm going to start by inviting Sherry Harper. Um, she's the Canada Research Chair in Climate Change and Health and professor in the School of Public Health at the University of Alberta, Canada. And we are very excited to hear from her today. So, Sherry, I can't see you on my screen, but I trust that you're there. And the floor is yours. Please guide us through the topics that we planned for today. So thanks very much, the three panelists. Later, I'll do a quick intro of Dr. Nicole Dawkins-Wright and Berta Luz Pineda, our friends from Jamaica and the Andean region. So Sherry from Canada, please go ahead.
Okay, wonderful. So I'm going to try and grab the screen from you. Hopefully this works. All right. Okay, you can see my screen okay?
Yes, perfect. Thank you.
Wonderful, thanks. Okay, so it's such a pleasure to be here today. I'm calling from Canada. Uh, I'm a professor at the University of Alberta, but I'm also a working group 1 vice chair for the IPCC. So I'm bringing that perspective today. So for me, when people are talking about scaling up climate change and health adaptation, I find that it's often imagined as, scaling up in a geographical or technological way, sort of like doing more things in more places. But today I wanted to talk about a different type of scaling up influence and representation. So, I want to ask the question, how can we ensure that the lessons learned in communities about what works for health and climate resilience can make their way into global assessment reports like the IPCC reports that help shape climate change COP decisions and funding flows? And for me today, that's the kind of scaling up that I want to talk about and the type of scaling up that my work within the IPCC is focused on. Yep. So the IPCC, the Intergovernmental Panel on Climate Change, this is a United Nations body, and its mandate is to assess climate science to inform global policy. We don't conduct new research. What we do is assess existing evidence from thousands of different studies. The reports are written by hundreds of volunteer scientists, and they go through a line-by-line approval session by governments. And so the IPCC assessments follow a really rigorous multi-year process. It starts with scoping and then author selection to ensure global balance and expertise balance. The authors draft the report, and then that undergoes multiple rounds of review by experts and governments. And this peer review process is incredibly rigorous and transparent. Authors have to respond to every single peer review comment that comes in, and every peer review comment and the author's response are all posted online publicly, so it's very transparent. And so just as an example, to give you an idea of the scale of these reports, in the last IPCC assessment on climate change impacts and adaptation, we cited over 34,000 different studies and assessed even more of them. There were 270 authors from 67 different countries, 41% identified as women, and there were over 62,000 peer review comments. So a very rigorous process. But what makes IPCC reports different from other science reports or UN climate change reports is the policy connection. So the final summary for policymakers is approved line by all 195 member countries of the IPCC. And this process is pretty unique within the climate change policy arena. So on the screen here, you can actually see our approval session or an example of an approval session. The scientists are at the front of the room, and all the member states are sort of back in the audience asking questions. And The sentence highlighted in green has been approved by governments. The sentence in yellow is under discussion, and the unhighlighted sentence has yet to be discussed. And
Ou
then on the
seja,
other,
é
oh,
necessário que nós descrevamos. Perdão.
oh, sorry. On the other screen, you can see these like blue lines of text, and that's all the track changes that are being made to the report. And because these reports are approved by all 195 member governments, they represent a globally agreed upon scientific foundation, which is why they often serve as the evidence base and common reference point for many of the negotiations and decisions that take place at the UNFCCC COPs. So in this way, IPCC sort of acts as a bridge between science and policy. And the findings from research and academic and grade literature are synthesized into these assessment reports, and then they feed into the negotiations. So the concept of scaling up is actually quite central in the IPCC assessment processes. Much of the climate health adaptation literature is place-based. There's lots of case studies rooted in specific geographies, communities, and contexts. And these are incredibly rich and meaningful. But the IPCC's task is to try and identify, common challenges or barriers and enablers of adaptation across hundreds of these different studies. And so the challenge, but also the opportunity, is to try and scale that up, scale those lessons learned from the community up without losing that local richness. So how do we ask the question, like, how can we extract broader insights about what works, but still honor the context and relationships and consider equity in those decisions? And so this is, a very complex assessment process where scaling up influence and scaling up representation really matters. So in our context, scaling up doesn't mean making a pilot project bigger. It actually means scaling up influence. So local adaptation lessons actually shape assessment findings, and also scaling up representation to ensure that authors, reviewers, and the evidence reflects that global diversity. And this shift sort of transforms community research, hopefully, taking case studies that might be unfairly called anecdotal or something like that, and sort of shifts them to being core evidence in the assessment reports. And so for me, scaling up within the IPCC context doesn't mean multiplying a pilot project or replicating a technology. It actually means the scaling up of influence and scaling up of representation. It's about rebalancing who produces the climate knowledge, who interprets it, and who benefits from it. So we were asked to comment on some enablers and maybe some challenges. So for us, what are some enablers of this type of scaling up? I think bridging organizations and networks to connect practitioners and scientists are really important enablers. Inclusive authorship and open peer review is very important. Recognition of Indigenous knowledge systems is incredibly important. Funding for synthesis and translation, as well as capacity building and mentorship. And so these are different types of levers that we can use to turn community-based insights into global influence. Some of the barriers, of course, they exist. There are hierarchies in knowledge systems, unfortunately. So there's a privileging of quantitative physics-based models in the IPCC assessment process over really important qualitative or other diverse types of knowledge. There's representation gaps. There's also institutional silos between the different sciences and working groups. So scaling up isn't just a scientific challenge, it's also a governance challenge as well. And I also wanted to comment on equity just a little bit. When IPCC is thinking about scaling up, we ask questions about who participates in writing and reviewing the reports, whose evidence counts, are communities credited and compensated for their intellectual contributions? Do the resulting policies benefit those who are most affected by climate change? And so without considering equity and justice, scaling up can risk extracting different, especially Indigenous knowledge systems or local knowledge systems, without returning benefits to those communities. So I'll end there for now, but my experience on IPCC, scaling up climate health adaptation, is often about connection and not necessarily about expansion. Scaling up should always create reciprocal benefits, not just scaling up, but also scaling across and scaling back down. It's about scaling influence and representation and equity so that the realities of people's lives shape the world, how the world understands climate risk and climate response in the health sector. Yeah, so thank you very much.
Thank you. Thank you very much. Sherry, thanks for the incredible work that IPCC has been doing for quite some time now. It's always a pleasure to read everything that comes up. A little bit scary, I have to be honest, because it's usually, we are a little bit scared of what we see and all the projections and all the results and the effects that we are seeing specifically on health. But it's such an incredible work. I don't think we will stop here, Sherry, for questions yet. So maybe we can continue. We can hear from the other two panelists and then open up, if you agree, to questions and answers. We do have an amazing chat going on while you were speaking. And I've been hearing, so keep coming, guys, keep putting on the chat. We love to hear where you're from. We love to hear who you are and what you've been doing in your country. So I took notes, for example, of Argentina, Brazil, Ecuador, Peru, a lot from the Caribbean, very good. Mexico, look at that. Very good. Jamaica, Grenada, Guyana, St. Kitts and Nevis, Dominica, Cayman Islands, Trinidad and Tobago, Panama, Canada, and then also outside of our, well, Guatemala now, Brazil, Uruguay, good job. And also from outside our region, UK, Indonesia, Tanzania, Kenya. So amazing. I'm loving to see that. Cameroon. So great. Keep putting there. Dominican Republic. So great, great, great to see the traction that this course is taking and really to be able to build this global community. So we are loving to see that. Keep coming. Also use the chat to put your questions, put your comments, because in the end, we're going to have time to go through them. So now I'll pass to our second panelist, who is someone that I know very well for a very long time, Dr. Nicole Dawkins-Wright. We've been working together under her leadership, of course, in the government of Jamaica. Dr. Nicole Dawkins-Wright was appointed the Director for Emergency Disaster Management and Special Services in the Ministry of Health and Wellness of Jamaica since 2018. That's how far we've been working, Nicole. So, wow. And she's amazing. I mean, I won't read her whole bio. I know that it's an extensive bio, but your work speaks for yourself. So, Nicole, please go through. Wonderful. Go Jamaica. Look at what they are writing in the chat. So you have people rooting for you. So please do them good and go for it, Jamaica. Thank you, Nicole, so much for being with us today.
Okay, thank you so very much, Danielle. To be honest, it has been quite a long time, and I remember it very distinctly. I am really, really happy to be here among so many persons from across the world. And I think, this speaks wonders for how much work has been put into this activity. And more importantly, I just want to thank everyone and the organizers in particular, for helping me to play a part in this conversation that we're having. Because as was mentioned before, it's all of us together and context is important. And to be able to use Jamaica to share as a case study, which is really a good way to help to transfer knowledge, whilst at the same time recognizing that context is important. And so thanks again and kudos to everyone. And Danielle, I hope our relationship goes on for very much longer, watching the transitions. So again, what I'm sharing is something that I think most of us here in the Caribbean are now very, very familiar with. And we've had opportunity to share the concept across different parts of the region as well as across the world. And it's a concept that has quite been accepted several times and shows to be very, very much in touch in terms of the smart healthcare concept developed and promoted by PAHO, or Key Technical Agency for Health Activities in Country. And so I'm going to share just on points. A lot of information is on the slide, but it's really a panel conversation that we're having. And so I'll speak a lot more freely than what's actually written on the slide. And what I'm speaking freely on is just to put the Jamaican context that I think is of particular relevance to help to bind the conversation and the points to engage the conversation. Speak a little bit on what the project was, the initiative was in general as it relates to Jamaica, and how we can actually morph that into wherever that goes on, and what was actually scaled. And so as busy as this slide looks, it really is just saying that Jamaica in and of itself is a small island state, and that alone puts some peculiarities, which helps us to understand that it's not one brush for everybody. So the information basically will indicate here on the slide that the region where the small island sits is also very important because it informs the priorities, and where the priorities are is where the resources are going to be placed. So we are in the region of the Americas, and we're very close to some of our Caribbean neighbors here, and we are one of the larger small island states. So we have that little peculiarity where you're too small to do great things, but you're also not so small in terms of some of the activities. And more importantly, in Jamaica here, whilst we can speak of a general tropical country, Jamaica has very clearly 4 very distinct climate zones. So even within country, we can't just broad brush everything. We have to tailor and contextualize some of our considerations. Because a lot of how we scale up, because that's what leads to transformation, it has to do with what our governance structure is in country. So in Jamaica, our system is based on the Westminster model of government. And so whatever initiatives to scale up is going to reflect the processes that leads to approval for interventions in country. And that is of particular significance. Where we speak in terms of what our health system is doing, generally speaking, our health indicators are not doing too badly. They're doing pretty good, actually. However, climate change, as you know, is going to adjust that downwards unless we do take significant transformative action for adaptation and lose the traction and the gains that we have. The peculiarity of our country is that being small, it's never usually one hazard that you focus on. So when we talk about adaptation actions, we pretty much have to put the other things that are going to contribute to the action in order for it to be scaled up and be sustained in country. And one of the ways that we have found that is that in the context of climate change, if we peg that to what informs a lot of our decision making in country, and that has to do with the emergencies and crisis and disaster risk management portfolio. Disaster risk management is one of those thematic areas that ties sectors, it ties players, it ties all the partners. And so once we can speak that common language, we generally have a lot more push and more momentum to be had when it comes to scaling up activities. Fortunately for us, a lot of our health system and the actions for scaling up, our health system is structured in such a way that it's largely about the public health system, and through a very multi-layered approach by systemic design allows us to mainstream a lot of the activities that we need to be scaling up. So in the context of where we are, because we're in the region of the Americas, the PAHO Plan of Action for Disaster Risk Reduction was what informed the activities that allowed us to easily bring in and add on to something that we would have started, is to rendering our health facilities safe against the multiple hazards, now adding on the climate consideration into that plan of action. And so now we can always use that framework for scaling up our activities. And so the activities in the context of climate change now, generally speaking, adaptation actions have to attack what are the major climate forces that are affecting our health systems, our health status in particular. Jamaica cannot separate the issues because once we deal with temperature in one area, we almost always have to deal with the fluctuations in precipitation levels and the availability of water. So addressing temperature challenges that we have, we also have to address the issues related to precipitation changes and variability that we have, not to mention the severity of extreme hurricanes that we're experiencing. And nowhere in Jamaica can we talk about anything that's either social or business oriented without considering that most of our economy and all our lived experience is linked to a lot of activities on our coastline. And so sea level rise is almost always a consideration in terms of where we need to go. And so what we are talking about scaling up, the PAHO would have presented the SMART concept in terms of the climate change as an idea for consideration. And what we have recognized is that while it was projectized in terms of introducing it to the beneficiary countries, of which Jamaica was one, it is a movement that has now been adopted since the project ended, which is very, very beneficial and applicable to Caribbean SIDS in particular, and very likely for all the other SIDS around the globe, as we have quite a bit of representation here. What it represents is an absorbable, comprehensive disaster risk management strategy. So whatever the focus is from disaster risk management, the concept bears significant application and can be tied into by virtue of the particular vulnerability that we have to the climate crisis, because it represents an absolute solution to addressing the issues that brings in the considerations from the multiple hazards that we're considering, while providing a multidimensional parameter or lens for resilience. What is most significant, however, which really makes a difference, is the fact that it comes with a metric. What gets measured gets done. Everybody understands numbers, and no matter which sector, which discipline we're in, from the mere fact of we can have a number that most persons can understand, it allows for progression, it allows for monitoring and evaluation, and it transcends sectors. For example, in some countries, we've already had the SMART concept already into education, into tourism, because it is so transferable that we can understand it, and it allows from a national level or a community level a monitoring and evaluation framework with one common language, and that's the metric of the A70 standard that addresses the different applications for leveraging resources and building on previous development targets. And so this busy slide is just to show, for example, that whilst conceptually it speaks to one model facility in the project, what we have managed to do is to consider the toolkit that came with the project, which is a model policy that allows for this project to adopt that model policy and bring it into a programmatic structure to ensure its sustainability. Originally, the concept was to bring one to that high standard, that A70 standard. The model and implementation in country, certainly in Jamaica and at least one other country that fell within this project, the smart healthcare facilities in the Caribbean project, is at least 3 different tiers of intervention that allows persons to select, or entities to select, what is their absorption capacity and how much can be done. In Jamaica, it spanned a total of 6 years, and so it spanned a good period to allow for us to bring on all our, build that coalition for that movement that we required, and more importantly, establish that baseline across the country with that metric that we can now build on and move across. So we were very, very happy at the timing at which it occurred, because once we set that first facility in 2022, by the time Hurricane Beryl hit us last year, we had demonstrated at least 12 facility and mechanisms for resilience building, and allowed it to be tested by a real event, Hurricane Beryl, and demonstrated, which allows for buy-in, that this system works, because the other facilities within the region where Beryl impacted did not fare as well as a facility that had that A70 standard, which says that we are climate resilient. So it is a number, it's a metric that we can measure, and it is something that can now bring on, having gotten the buy-in, to move on and build across the country. And so what is important is that PAHO has rendered the toolkit for this concept available free of cost online through that toolkit that can be accessed. And so in terms of what we've had, specifically as it relates to what we are presenting here for scaling up, during the time over the last 6 years, there have been 3 related other projects which demonstrates replicatability of the SMART concept across different projects, different funding mechanisms, and different systems of governance. And it maintained that it can be done because we did it with the other 3 projects, one of which, for example, is this work that we're doing in terms of our Improving Climate Resilience project, as well as another one completely unrelated through the UN system for the WASH project, again, tied onto that SMART concept, so we can thematically implement on that one single puzzle that allows for scaling up. And so the other thing is colored. The picture here shows that the progression is what we need to measure and track. You can apply a heat map on the different adaptation actions, and when you plot it along all the aspects and see the change in colors, for example, for Jamaica, before the beginning of the project, it was mostly in the red. And as the project was being implemented, we saw the progression of that heat map to a more greener perspective, indicating an improvement in resilience, climate resilience across the country, which I think is one of the things that helps in terms of maintaining the momentum for scaling up adaptation actions wherever we sit and however we approach it. And so how it was done is that we built it, it was done through by making sure that the initiatives were implemented at a rate that we can manage, that counters, for example, the different hazards that are climate related, but at the same time factors what the facilities or the local or the beneficiary can absorb. We can have this great solution, and if we don't have the capacity on the ground to accept the support, it won't go anywhere and it dies at the end of the project. If it is to be scaled up and sustained, we have to tailor it to the absorptive capacity at the local level. And so the implementation of the project demonstrated some key lessons for scaling up adaptation action. And what it showed is, for example, certainly in SIDS anyway, at a community level, the health facility is probably the one constant that can tie all the players together for a community level activity. Schools will change in terms of being relocated if the population gets older. However, the health facility will always be required. And so it doesn't have to change, and it's good investment to scale up our activity, and everybody understands that. So whether it is a major funding agency or it's a philanthropic entity, such as a person who is coming back home and wants to help, you can tie that into something that they want to favor in and use the same concept and the same language to scale that up because there's ownership of the intervention. The need for prioritization is also key. Where prioritization will tend to happen is where the resource is coming from. So if we understand what the resources are and where they're coming from, and we already have in the back of our mind what prioritization may look like, then we are prepared and are ready for accept any scaling up intervention that will occur. The assessments, again, were done using existing staff. We didn't need specialists to do it, because in small island states, for example, we always have this issue where we have a high turnover of staff, and so we lose skill sets when we build capacity. The SMART concept allowed for existing persons and build a pool of persons who can conduct that assessment, and so you don't lose that capacity once persons are moving. So it addresses the issue of high rapid turnover that is almost pretty characteristic of us here in the Caribbean, and certainly for small island states in general. Building on existing systems is absolutely critical. It's the same set of people that are implementing the project, that are doing other activities, that will also have to do all the climate change adaptation action. So if we have a crisis in country, what generally tends to happen is that things are put on hold. If, however, that system is tied onto something that's already in place and routine, it doesn't get put in the back burner. It keeps on going, and so the project could be successfully implemented even during the COVID-19 outbreak, which devastated many, even while we had the passage of several severe weather events, and even while we had a major shakeup in terms of seismic event, without stalling the project. Again, because it's built on our existing system, and so activities will always continue because there's that ownership at that level. Mentioned before, but would have seen in the first presentation is that it must be tied to policy. So Jamaica has one mechanism, but common to every country is what informs the way policy is actually done. And the process is the matter of feasibility. Feasibility is different in different countries, but certainly in our context, because disaster risk management is a priority, the resilience agenda is what allowed for the policy to be adopted because it was therefore very acceptable and feasible because it ties into the project. And so I'm going to close off here to say that one of the things that allows for scaling up is that there must be a stage contextualized to our local environment. They must go through a process of prioritization or a mechanism that will apply for prioritization that demonstrates some of the benefits and quick wins. And the means of sustainability is that if we use a common language that transcends different administration, which usually means a metric that shows progression. In the case of the SMART initiative was the metric of A70 for resilience, then it doesn't matter which administration is operating, it will maintain its conversation. And so the activities are three in particular: how to institutionalize a program. The action speaks to the adoption of the model policy that was there, and now we can demonstrate that by the mechanism of its methodology, we can link it to collaboration with other sources of income. And in Jamaica, that was the Climate Finance Access Network for follow-on projects that will support ongoing nature of the program. And so there are several pathways that can be done for mainstreaming them. And we put it into our national development plan. It could vary for other countries, but it does help that it's in our national development plan. And certainly in terms of our disaster risk management program, it is linked to the regular programmatic activities, and it applies across in our country, 3 different levels of administrative management, and so they can peg it onto their activities and build it into their wider operational plan for each year. So based on this initiative for successful scaling up, there appears to be at least 5 key steps for wider adoption of policies to allow for scaling up. Consider the policy process that is natural. Ensure that there's a process of sensitization of all the players. Ensure that language speaks to the basic elements of the activities. Timing is also critical, and integration will follow the overarching development goals that applies to the country at the time. And so with that, Danielle, I would say thank you, and available for any questions, and hopefully we can get into some more discussions on these issues.
Thank you so much, Nicole. It's always very exciting to see all the work that is being done in Jamaica. Also, I take notes of the connections that you're doing with this whole retrofitting of healthcare facilities, hospitals, but also the Health National Adaptation Plan, the resource mobilization part, the building governance across entities and across sectors. It's paramount. And maybe for us to think of one of the questions or comments for the questions and answers part is also how the early warning systems and the prevention work, climate informed systems on health can help preventing things from going wrong. And then, of course, that we cannot prevent everything from happening, especially if it's a extreme weather event. But I mean, a lot can be done with risk communication, with preparing communities, with engaging different partners in learning what's about to come and getting ready in advance. That's maybe a key part as well to guarantee that the population is not going to be as much affected as they could if nothing was done. But it's amazing to see all the work that is being done to make sure that healthcare facilities are operational when they are needed the most, which is during or soon after a disaster. But thanks a lot, Nicole. This is to be continued, that discussion, very soon. And finally, bueno, ahora yo voy a cambiar a español para
And now I'm going
saludar, ¿no? a
to
Berta Luz.
switch to
Primero,
Spanish to
sea, estamos
say hi
bajando, ¿no?
to
Empezamos en
Berta Luz.
Canadá,
So
tomamos
we're
un
coming
vuelo
down. We
hasta
started in
Jamaica y ahora
Canada. We took
vamos a
a
Lima,
flight
Perú, con
to
Berta Luz
Jamaica, and
Pineda
now we
y
go
también
to
venimos trabajando
Lima,
desde hace
Peru
muchos
with
años
Berta Luz
en el
Pineda, with
tema del
whom
Plan
we
Andino
have
de Salud
worked
y Cambio
for
Climático, que el
years
organismo
in the
mundial de
Andean
salud
climate change plan,
que
which the
coordinando
Andean
en la región
health
andina.
body
Así que
has
muchísimas gracias, Berta, muy
coordinated in
amable
the
y como
Andean
siempre
region.
por
So thank you,
participar de este
Berta,
evento.
as always,
Y
for
si nos
taking
puede,
part
bueno, tiene
here. And
a tu
you have
disposición
now the
las
floor.
diapositivas y nos guías por tu presentación. Muchas gracias una vez más y después pasaremos a
Thank
la
you
parte
so
de
much
preguntas y
once
respuestas.
again, and then
Así
we'll
que
have the
muchas gracias, muy
Q&A
amable,
session.
Berta. Tienes el
Thank you,
micrófono
very
disponible.
kind, Berta, for being here. You have the floor.
Quiero en
Thank
nombre
you.
del Organismo
Great.
Andino de
Thank you so
Salud y del
much.
Comité
On
Andino de
behalf
Gestión de
of
Desastres y
the
Cambio
Andean
Climático,
Committee,
agradecer la
I would
invitación a
and the
esta
climate
importante
change
sesión.
held from
Escucha,
the Andean Plan, I would
escucha y
like to thank you
aprendizaje
for this
hermoso, Pío.
session. Listening and learning, it's so
Desafío que tenemos
important.
de escucharnos cada vez
So we
más,
do have
de
this
generar
great
diálogos, de saberes
challenge of listening
diseminados,
to
poder
each other, of
contribuir en este
creating, of
espacio
having
de
a
una riqueza
conversation,
saludable para todos
of
y todas las
bringing together
participantes.
knowledges. It's
Vamos a
great to
compartir una
contribute to this
experiencia
space.
significativa.
I
Es
would
el
like
Plan
to
Andino de
share a
Salud y
very
Cambio
important
Climático.
experience with
Para
you,
dar
which is the Andean
contexto, he tenido
Plan
tiempo de
on Health and
escribirles
Climate
propuestos
Change.
en la
Some
sesión,
context.
identificar
I have
desafíos y
considered
soluciones
the
comunes,
objectives in
reconocer
the session,
oportunidades de aprendizaje, de
identifying
colaboración y
common challenges
contribuir
and
al conocimiento
solutions,
colectivo, para
acknowledging
dar un
learning
marco
opportunities, and
donde
contributing to
surge
collective
este
learning.
plan andino, surge
To
el enfoque
provide
del
a
Organismo Andino
framework,
de Salud
and
como un
this
ente
Andean
humano y que es una
plan
entidad
stems
intergubernamental
from
de
an
integración
intergovernmental
subregional que
institution.
agrupa
It's
a
an
los ministerios de salud
sub-regional
de 6 países
institution that
andino:
brings together
Bolivia,
ministers of health
Chile,
from six
Colombia,
Andean
Ecuador, Perú y
countries:
Venezuela. El Plan
Bolivia,
Andino
Chile,
de Salud se
Colombia,
convirtió
Ecuador,
en estos
Peru,
procesos de
Venezuela.
integración
It was
regional
created in
tan importantes
1871.
y significativos en
It
la
is a
región.
very
La máxima
important,
autoridad es la Federación
it's
de
very important
Ministros
in the
y
region.
Ministras de
The
Salud de los
main
6 países andinos.
authority in the
Con
are
estas
the
crece el
health
sistema andino de
ministries.
integración y la misión es en el 2030
And
los habitantes de la región andina
vision
gozan del
by
derecho a la salud
2030,
y al
the
bienestar, las
citizens of the Andean
desigualdades se han
region will have the
reducido
right to
y hay una
health,
mayor capacidad de
well-being,
respuesta
inequalities
conjunta
will have
a los
reduced, and
desafíos
there is a larger
sanitarios,
capacity
socioeconómicos y
to jointly
ambientales
respond to
comunes a través de la
common
integración y
health,
la
socioeconomic, and
cooperación regional.
environmental
Es
challenges through regional
subrayado,
integration and
colocado en
cooperation.
negrita integración y cooperación regional
I
porque es el
have
eje que se debe
highlighted
fijar en este
regional cooperation and
importante desafío
integration
de
because that's
fortalecer
what
las
we want to
capacidades de
focus
adaptación
on
y la
when it comes
respuesta al
to
cambio climático. El Organismo
strengthening
Andino de
adaptation
Salud trabaja con
capacities and
instancias de
climate change
integración
response.
regional.
This
Veintiséis
organization
comités,
works with
5 grupos de
regional
trabajo, 2 redes,
integration
la Misión Intersectorial de
organization.
Concertación
We
contra
have
las
26 Andean
Desigualdades en
committees,
Salud.
5 work
Todas
groups, 2
estas
Andean
instancias
networks, 1
responden a prioridades
intersectoral
de salud que se han
Andean
identificado de manera
um,
conjunta y
group.
colectiva
The idea
entre
is
los
to
6 países
address joint
andinos.
and
Y todas
collective
están constituidas
um,
con puntos
challenges,
focales. Casi
and
siempre
they all
los
include
coordinadores de
focal
las tareas
points. It's
priorizadas de los
usually the
ministerios de salud
coordinators
de
of
los
the
seis
priority
países
areas in the
andinos.
ministries of
Voy
health
a hablar
of the 6
específicamente de
Andean
una experiencia
countries. I would
desarrollada
like to
por el
specifically
Comité
talk about
Andino
an
de
experience
Gestión de
developed by the
Desastres y Cambio
uh,
Climático.
Andean
El
Committee
tema de respuesta a
for
los desastres está presente en el
disaster
Organismo
management and
Andino de
climate
Salud desde
change.
el momento de
This
su
has
constitución
appeared,
en
this has been part of the
1971. Por
organization
ejemplo, para
since the
llevarle
very
una
beginning,
respuesta común
1971.
a la
For
primera
instance, in order to
conferencia
have a
que se
common
hizo en
response,
1972 sobre
a
temas
common position
ambientales.
in the
En el
first conference held in
2005 se
1972 about
constituye el
environmental
Comité de
issues.
Gestión
In
de Desastres y
2005,
Cambio Climático y en el
disaster
2006 ya se elabora el
Risk
primer
Management
plan
for
andino.
Emergencies and
Quiero
Disasters
destacar que en
Committee
el
is
Organismo
created. In
Andino de Salud es
2006,
muy
the first
importante
Andean
trabajar
plan
bajo
is developed.
políticas andinas
It's very
y
important to
virtuales
work with
ante los
Andean
elederados con los delegados de
policies
los 6 países andinos y
with
que respondan a las
delegates from the
necesidades de
6
los 6
Andean
países.
countries to
Este
cater to the
primer
needs of the
plan
6
de gestión
countries.
de
This
desastres,
first
a que
disaster
viene del
management
marco en ese
plan
momento,
uh,
hace
at
énfasis en la
this time
respuesta. Posteriormente,
focuses on
se plantea
the
un enfoque de
response.
más de prevención y reducción del desastre.
And then we also
Es muy
focus on
importante que
disaster
trabajamos con
uh,
organizaciones sociales, no
reduction and
solamente con el
prevention,
delegado
which
del
is
Ministerio de
very
Salud.
important that we work with
Dentro de
social
las
organizations,
organizaciones
not
socias
just with
está la
delegates from
Organización
the
Panamericana de la
health
Salud, la
ministries.
Alianza Global para
Among them, we
Prevención,
have the
Salud y Ciudadanía, el
PAHO,
Consorcio Global
also
de Educación en el Campo de Salud, el Instituto
the
Interamericano para la Investigación del
GCCHE,
Cambio
the
Global, el
Inter-American
Centro
Institute of Global
Latinoamericano
Change
de
Research, the
Excelencia en
Latin
Cambio
American
Climático, el Centro de
Center
Cambio
for
Climático y
Excellence in
Salud para
Climate Change,
Latinoamérica y el Caribe,
the
Fiocruz, las
Climate Change Center for
universidades y
Latin America and the
directores.
Caribbean,
El
Fiocruz,
desafío entonces, el
universities,
primer
etc.
marco fue el
So as I
Plan
was saying, the
Andino de
first
Gestión de
framework was the
Desastres,
Andean
que
Plan
en el
to
2018
manage
ya plantea una
uh,
perspectiva más
these
de énfasis en la
disasters. In
reducción del desastre
2018, they
y
focus on
plantea 6 grandes
disaster
planteamientos esperados: la
reduction, and
actualización
they
de la
focus on the
normatividad, la
expected outcomes.
reducción del riesgo de
Also
desastres,
updating
la preparación y respuesta frente a
regulations,
emergencias y
disaster risk
desastres, los
reduction,
mecanismos de asistencia
preparedness
mutua y
in the
cooperación
case of
y las
emergencies and
capacidades y
disasters,
competencias del
also
talento humano. En
the
respuesta,
human
ahora en las
capacities and
reuniones
talent.
realizadas en
Um,
2017 en Caracas,
to
Venezuela,
reply to one of
los
the
ministros y
meetings
ministras de
held
salud
in
pidieron que en este
2017 in
plan
Caracas,
incorporaran la
Venezuela, the
adaptación
ministers of
del cambio
health
climático, que en
requested
ese
that the
plan
climate
de
change
desastres
management be
el
included. And
propósito
in that
en relación
disaster
con
plan,
este objetivo 6
and
es
regarding
contar
this
con una
objective 6, they
metodología
aimed
o
to
herramienta
have
que
a
permita
methodology
incorporar
or
el
tool
cambio
that would
climático en la
allow us to
gestión del
include
riesgo
climate
de
change
desastres en el
in
sector salud.
disaster
El primer
risk
resultado
management in
esperado
the health
planteado
sector.
es que
The
los
first
ministerios de
expected
salud
outcome
cuenten
is
con
that ministers of
información
health
sobre
should
los
have
efectos del cambio
information about
climático
the
y su
effects of
impacto
climate
en la salud,
change
y que
and
esto sirva para
its
ejecutar
their
acciones
impact on health,
tendentes
and
a
that
disminuir
this
los riesgos. En
informs
el plan objetivo, que
actions to
siempre se hace de
decrease
manera
risks. And
participativa
this
en
is done
reuniones
in
virtuales y
a participatory
presenciales,
way in
también
virtual
mediante
and
los comités
in-person
ángeles
meetings
y que
with
luego es
committee
aprobado por los ministros.
members.
Un resultado esperado fue
And
aportar evidencia
this
científica para
unexpected
el abordaje
outcome was
integral y
providing scientific
planificado de
evidence
acciones
to
sobre el cambio
comprehensively
climático y la
address
resiliencia
and
frente a los
plan climate
desastres.
change
En
actions
el
and
2018 y
disaster
2019
risk
hicimos
management. In
con los
2018,
miembros del comité, los
2019,
6 países, la
we worked
cooperación
with
del
the committee
Ministerio de
members,
Salud y de la
6 countries,
Organización
a
Panamericana
financial
de
and
la Salud,
technical cooperation
varios
of
estudios que
PAHO.
también incorporaron la perspectiva desde la
Several
sociedad.
studies included the
Uno de los estudios es
perspective.
Tendencias del Cambio
One
Climático
of
en
the
África y Oriente, que
studies
muestra
uh,
cómo se está
focuses on
incrementando el
climate change
cambio
in the
climático,
region,
la
and it shows
temperatura de
that
otros
climate
climas
change
y
and
los efectos
temperature
en la
and
salud,
other
así como el
countries are
análisis de
now
situación
uh,
de las emergencias y
worse. And
desastres,
this
los
is very much
indicadores
affecting
básicos de
health,
salud y
as well
cambio
as
climático,
we also
indicadores
analyze the
sanitarios
emergency
locales
and disaster
pesados y el impacto de
situations,
plaguicidas. Estos
indicators,
estudios estaban
also the
citados y
health
publicados en
impact
la
of
página
heavy
electrónica
metals and of
del Organismo
pesticides.
Andino de
These
Salud.
are posted on
Reitero
the
que están
website of the
realizados a partir
Andean
de
Health
procesos
Organization. These
participativos
studies
con los
are
delegados del
conducted
comité, los
in
ministerios de salud de
participatory
los 6 países
processes with the
andinos y
delegates from the
organizaciones
committees and
sociales.
ministers of health, and also
Cuando teníamos los
from the
estudios
6 countries
en el
and
proceso de revisión,
and partner
hicimos 2
organizations.
reuniones presenciales
In the review
que fueron
process,
muy
we held
importantes
2
en Chile
in-person
en este
meetings, which
caso.
were
La primera
very
reunión
important.
fue para
In
revisar
Chile,
estos
in this
estudios y la
case.
conclusión a la que llegó el comité andino
And
es que no era
the
suficiente con el
findings of the
cambio
Andean
climático
Committee
como un objetivo
showed
del
that
Plan
it
Andino
wasn't
de
enough
Gestión
to
de
have
Desastres.
climate change
La
as an
problemática era
objective of the
cambiada que
disaster
ameritaba que
Andean plan.
realizáramos un
The
plan
problem was so
específico
huge
para dar
that we
respuesta
had to
a
prepare
la
a specific
problemática del
plan
cambio
to
climático. Y en la
address
reunión en
climate
agosto
change.
nos centramos
Uh,
en revisar el
Specifically, in
documento que habíamos
August,
elaborado de manera participativa desde abril hasta
we
agosto en un
decided
taller específico
to
de revisión de
address the
ese plan.
specific
Este
document that we
fue
have
un
prepared in a
trabajo
participatory way
colectivo con los delegados de los
between
6
April
países y
and
organizaciones
August. Here
socias.
you can
En
see
este
the
caso,
delegates from
también
the countries and
participó
partner
el Ministerio de Medio
organizations.
Ambiente, entre otras
We also had the
organizaciones, con la
participation of the Ministry
cooperación
of
de
the
la Organización
Environment
Panamericana de la Salud.
and other
En el
organizations,
2020,
together with the cooperation of
en el marco
PAHO.
de la pandemia, seguimos trabajando
In
con este
also in
documento y
2020, we
logramos
kept
tener
on
este
working, and we
documento del
managed
Plan
to
Andino aprobado en una
get
reunión de
this
ministros en
Andean
abril
Plan
del
document
2020.
approved
¿Cuál
in
es el
April
objetivo
of
que nos propusimos?
2020.
Contribuir a la disminución del
We
impacto
decided to
negativo
contribute to
sobre la
decreasing
salud
the
y la
negative
población que el
impact
cambio climático
of
a
climate
través de
change
la
on health.
intensificación de las
By how were we going to do this? By improving cooperation networks and improving also progressive integration among countries. This is the first joint political instrument that in this region that addresses the connection between climate change and health. It brings together the ministers of health of the 6 countries, Bolivia, Chile, Colombia, Ecuador, Peru, Venezuela, and partner organizations. We published it with PAHO, together with PAHO, and you can see here the committee members of the 6 countries and also the ministers of health. Which are the expected results? Coordinated work among the different offices of the Ministry of Health, also strengthening human resources, intersectoral, multi-level, multi-stakeholder, multidisciplinary work, also epidemiological surveillance, analyzing vulnerability and risks faced with climate change, investigating and systematizing experience and ancestral knowledges, creating sustainable and climate resilient health services, protecting the environment and ecosystems, promoting health and social participation, preventing the vector-borne diseases and their dissemination as well. During the pandemic, we launched the plan. We coordinated and worked with PAHO, with the ministries of health of the 6 countries, and we had the participation of 15 partner organizations and over 15 participants who joined us virtually. In 2021, and during the pandemic as well, we held the first follow-up forum to monitor the actions under the plan. The picture shows here that we had over 1,000 people joining us, and also a huge number of comments. Main results we worked a lot in 2021 and 22, but then we also worked in 2023, 2024 regarding the development of a regional project. We need projects that address the needs of the 6 Andean countries, and this project aims to promote sustainable and resilient health systems when it comes to the climate in Andean countries. We exchanged experiences through online meetings. We talked about health and climate change indicators. Also, the Andean Health Organization, they joined the Green and Healthy Hospitals Network. We trained delegates from these countries when it comes to measuring the carbon footprint, and we've also supported this experience of strengthening health centers. We have also participated in COP26 with PAHO, and we talked about the experience of Andean countries, in particular the conceptual framework and the good living practices and ancestral knowledge as a social innovation. And this is an innovation that countries can show the world. We conducted a study on the perception of climate change among adolescents, and we have disseminated the results in several events. Also, between 2023 and 2024, we had the cooperation among countries for health development. This is also a PAHO initiative that helps the committee to strengthen the exchange of ideas, also South-South cooperation. We exchanged experiences. 10 professionals from Andean health ministries participated in an experience exchange focused on sustainable health facilities and intersectoral work in health and climate change in Bogota, Medellin, and Cali in October of 2023. We also held a regional meeting between partners for addressing health and climate change in November. And myself and as the committee coordinator, I participated in the regional training workshop Climate, Environment, and Health for the Americas. This was the result of two other courses we had already participated in, and we were awarded a seed grant fund to conduct the following study: multidimensional vulnerability to dengue and diarrhea in the context of the climate crisis with a TD approach, and the inclusion of knowledge, different types of knowledge. This was funded by the Inter-American Institute for Global Change Research. We have also participated in several events, and we have also always talked about regional integration when it comes to the health sector responding to climate change in several events, such as the Biodiversity COP16. In 2023, we also conducted an online course with 765 participants, PAHO, the GCCHE, and the active leadership and participation from the very beginning of the Andean Committee, with the 6 countries participating as moderators. And also the secretary of the organization sent a letter to ministers of health so that she would appoint the participants in the course that, as I said before, had 900 people registered. Regarding a request sent by the National Health Institute in Peru, they were worried about strengthening health and climate change research in the National Institute. They wanted to prepare a national forum as we were coming together with other key organizations such as PAHO, the Ministry of Health in Peru, Cayetano Heredia University, etc. This became the first International Congress on Climate Change and Health Research. 3 days of work with over 200 attendees attending in person and nearly 5,000 people connected virtually. We also have the cooperation of PAHO as we received funds from them. And also the IMO provided funds to bring speakers to the Congress. And we also had the help of health institutes and ministries of health as well. The information is online, also the lessons learned and recommendations. So this intersectoral committee supported second Congress held in Mexico with over 67 speakers and over 3,000 participants. What we must remember about these international congresses is to provide an overview of research on climate change and health, the impact on health, adaptation and mitigation, climate justice as a huge pillar, because we need to focus on how climate change affects the people who have least contributed to it, and also what we must focus on climate justice. Also, we need to improve in Latin America. We need to implement the TD approach in Latin America. We also need to improve funding for research. We have worked with representatives from the ministries of the environment, health ministries, etc. We also had a specific session between Peru and led by Peru and Mexico. The committee showcased its experience when it came to integrating research. We also held the regional forum of national health institutes. The Peruvian Health Institute shared the regional agenda to strengthen climate change research. And we had boys, girls, and adolescents participating in every Congress. They aim to protect and defend their rights. We organized 25 webinars, and you're all invited to the webinar to be held on the 16th of October, 11 a.m. Peru time, to celebrate the International Day for Disaster Risk Reduction. In 2025, we have had the participation of the Andean Health Organization and Committee, in the common position of Latin America and the Caribbean and climate change and health. We also participated in the 2025 World Conference on Climate Change and Health. We contributed to the Belém Health Action Plan for Health Sector Adaptation to Climate Change, COP30. We have also consolidated opportunities for exchanging knowledge and experiences. It's also important to strengthen cooperation, coordination, and joint work between the focal points of the Ministry of Health and partner organizations. Our Andean health plan's greatest motivation lies in integrating science, policy, and social action within a regional, collaborative, multi-level, and intersectoral framework. It's also important to focus on a participatory approach so that we can listen to each other and build together in order to promote regional progress and positioning health as a pillar when it comes to facing climate change challenges. To finish, I would like to go back to the results of the survey you sent us. But I would like to say already that last year, with the technical and financial cooperation of PAHO, we conducted a participatory assessment of the climate change and health plan. Many of the results also appear in our assessment of in the results of our assessment of the plan. But right now, I would like to talk about key challenges for the Andean region. We need to keep strengthening South-South cooperation to share tools, experiences, and contextualize solutions. We need to promote the production of regional public goods such as guides, standards, and training platforms. We must articulate scientific evidence with strategic communication to mobilize political will and funding. We need to contribute to the strengthening the ministries of health with clear mandates, resources, and technical support. Opportunities for the Andean Health Organization and for the committee, because we need to keep coordinating, promoting South-South cooperation and institutional strengthening. The Andean Health Organization and the committee can actually harness South-South cooperation to exchange good practices and promote regional adaptation standards. We have just held a meeting with the help of PAHO. We are now resuming the assessment we conducted last year to assess the climate change and health Andean plan and to have the version of the 2026-2030 version of the Andean plan that will include the results of the assessment and specific policy aspects such as the global climate change and health plan as adopted by the WHO, the Belém Plan, and other regional and international plans. I would like to gladly share with you that on the 16th of October, in that session, I will be providing more details about the results of this new version of the Climate Change and Health Andean Plan that includes several global and regional challenges. I would like to finish by saying that to address climate change in every country, to strengthen health preparedness, to face climate change is a huge and urgent climate justice action. And we need to do this in a coordinated manner by sharing experiences and lessons learned by learning from one another, because together we're stronger and together we will go further. Thank you so much. Great. Thank you so much, Berta. Congratulations on your presentation. Congratulations on what is being done in the Andean region and in the Americas, because this also really impacts what the other countries in the region are doing. Excellent.
English, but we'll continue this dialogue. Ahí está, aplausos desde Perú, así que muy bien. We had so far, I'm counting 37 countries at least that people wrote here that they are participating. And we had over 800 participants at this point, at some point in these webinar. So great participation. Thanks to keep sending questions, to keep sending comments, to keep sending your messages to us. I'm gonna share my screen again, and we'll continue with this program. So before we go to a mini roundtable for our panelists and where your questions and comments are going to be read, and we're going to start discussing that, we have, be ready, get to your keyboards, or if you're attending by phone, and we have two questions for the audience. So we have two questions for you. We want to hear from you and listen and learn from you. So based on what you heard here today and based on what you work, so what is needed to scale up your current adaptation initiatives? And which partnerships are most critical to expand adaptation efforts in your country, community, or organization? So please go ahead, go to the chat, run to the chat, and help us with those questions. Maggie, I cannot see them because I'm sharing my screen, but maybe you can guide us as well. Maybe I'll stop sharing just to take a look. Is something coming, Maggie?
Yes, I think people are putting their answers. Hopefully they're typing away.
Yeah, so go ahead. I'll put again my apoio, autonomia, condições de trabalho. Bom, condições de trabalho, isso está em português. Can I have the questions on the screen, please? Yes, of course. What do we need to continue to expand? These questions, Maggie is putting the questions as well on the chat in different languages, right, Maggie? ¿Qué es necesario para aumentar, ¿no?, nuestra capacidad de adaptación o ampliar
What do we
las
need to
iniciativas de
increase
adaptación?
our adaptation,
¿Quiénes son los
scaling
socios
up our adaptation
más estratégicos?
initiatives, and which are our most strategic partners?
Let me see again if I can read the chat. Fantastic. So we have, we need people to be mobilized. Elizabeth Rangel, thank you. We need to be mobilized and to sensitize people. We need a governance structure, collaboration between stakeholders, training professionals, health professionals, so they understand the needs. Communities in rural areas, that would be kind of one of the partners that are needed. Political will, clear indicators to measure the progress, better integration between academia, communities, and governments. So keep coming. We are collecting all your inputs, and all your inputs are going to be collected by us and will help us to do the report of this session. Saludos desde Hungría. Very good.
Hello from Hungary.
Participation, multiple levels, youth engagement, very interesting. Resources to implement the Health National Adaptation Plans. Well, private sector. That's a good point as well. We talk a lot about the public sector and the governments and all, but private sector needs a better engagement. Financing appears everywhere. So very good. Although I always try to pose a question back. So what if we had a $50 million check here on my pocket that would be transferred for you today? Would we be ready to implement that? Would we know what we need, exactly what we need to do and where we need to put our investments? So keep coming, but in the meanwhile, so Berta alluded to that, right? That we have the collected, all of you have inputted in the beginning of this course, and you keep contributing to that. So this is just a quick snapshot of who we are, right? From 2,705 participants that responded to the survey in the early stages of this course, almost 2/3 said that they have received at least one climate change and health training in the past, and 1/3 of the participants, more or less, is a newcomer to this topic. So welcome to this topic. Here's a little bit of the description of who we are from Ecuador. Look at that. Good job, Ecuador. Brazil, Peru, Canada, Colombia, top 5. So I hope that after today, we're going to see these numbers changing and going up. Yeah, so government, most people is from the government or academia. And we see that, private sector, NGOs or other represents a certain fraction of our participants. So who is scaling up health adaptation to prepare for climate change? So we do have a fairly good amount that said yes, 28%, a third of the respondents, or partially, which is the majority of people, 36%, no, 17, unknown, people didn't know what to respond, 15%. So we see that, there's a fair amount that is already moving forward with some activities for adaptation on climate change. And with existing and planning efforts, please rate how prepared your jurisdiction or organization is to meet the most severe expected impacts of climate change and health. So we see that, well, if you count that up to 5 is like half the scale. I mean, the great majority of people say that they are not yet ready, right? Or they don't feel ready, not themselves, but the space where they work, the governments where they work, the organizations where they work, or the communities where they are not yet fully prepared to scale up adaptation investments and adaptation actions to climate change to deal with the health impacts of that. But it's just, I always like to see the good side of it, that, at least we have something around 20% of people or institutions that said that, they are already in a 7 to 10 rating scale of being ready to tackle the effects of climate change. So if we've done that a few years ago, the numbers will be much lower, I believe. And lastly, what challenges? So Berta Luz was also alluding to that. So what challenges do you think that your organization or where you are face to rapidly scale up health adaptation? And as I was mentioning, most people always respond, we don't have the money to do it. And, that might be partially true from what I understand, But having the money is not everything, right? We need to know what problems are. We need to have the tools to be able to identify what are the key topics to be addressed. And that maybe appears as the third answer there: lack of clear guidances, tools, resources to assist, or lack of scientific evidence regarding impactful adaptation solutions. And we hope that this type of discussion, especially this session, is helping you to have new ideas and also to exchange ideas with colleagues to be able to absorb them, adapt to your own contexts, and then move forward. But also there's a second one on lack of personal expertise. And I think that this is particularly true. And because this topic of the health impacts of climate change and how the health and health determining sectors can do to tackle these problems is something that is slowly growing. And this year, as you probably know, we have the COP30 coming very quickly in a month, and in Belém do Pará, Brazil. And there, I presented that in the first in the introduction session. We have the Belém Health Action Plan. So this Belém Health Action Plan would be presented by the government of Brazil as the presidency of COP30 to member states of UNFCCC to serve as a global roadmap on climate change and health. And the Plan Andino de Saúde y Cambio Climático, the Caribbean Action Plan on Health and Climate Change, the WHO Global Plan of Action on Climate and Health, they are all supporting the Belém Health Action Plan, as well as all your health national adaptation plans and local level adaptation plans that might be supporting to this Belém Health Action Plan. November 13 is the Health Day at the COP. We are going to have multiple sessions going on in the WHO pavilion as well. So you're most welcome to participate with PAHO, WHO, and many other partners there. Now, if I can ask my beloved panelists to open their cameras, we're going to share with you a few questions that popped up in our chat. So Sherry, yes, thank you very much for sharing this screen with me. I'll start with the order that we presented. So Sherry, there are a couple of questions about the how can indigenous communities better leverage influence with funders and with decision makers when their traditional approaches to emergency management don't align with colonial funding structures, and when successful indigenous-led practices are not being shared or recognized, especially when highlighted by non-indigenous allies. So would the IPCC, in all these mechanisms, how to collect indigenous knowledge or non-traditionally scientific knowledge into the IPCC? I think it's a very fair and interesting question. Thank you.
Yeah, thank you for that question. In fact, that's something that in this current IPCC cycle, we're trying to address. There's a lot of room for growth and improvement in terms of how IPCC engages with Indigenous knowledge systems. So there's a lot of effort around that this cycle to try and improve it. Just a couple weeks ago, we had an expert meeting on gender, equity, diversity, and inclusion in IPCC processes. In February, we're going to be having an expert workshop that includes a core theme of engaging with diverse knowledge systems, which includes Indigenous knowledge. The authors this year for IPCC, we have several Indigenous lead authors or coordinating lead authors in each of the working groups, including Working Group 1. So there are these small things that we're trying to do, but there's still, then we have to actually engage with Indigenous knowledge systems in an ethical way. So our hope is that assessment and that inclusion of Indigenous knowledge will be led by Indigenous peoples themselves. And then, hopefully that will be robust and rigorous in the actual IPCC reports, which can provide sort of like an entry point to bring some of those knowledge systems and those lessons, including on health adaptation, into the climate change COPs. The question about funding is a little bit trickier, and to be honest, I don't have a good answer. I think that there's a lot of room for growth and improvement on that, and a challenge, but also an opportunity to maybe try and think creatively about how to address that funding question.
Yeah, I believe that the funding question can be addressed in a way, if you present the evidence, then that's what's going to leverage funding on a particular path. But thank you, Nicole. For you, a couple of questions are popping up. I already posed to you kind of one right in the beginning for you to start thinking on, it's great to have the infrastructure ready for an event to withstand a hurricane, for example, in the case of the Caribbean, but also how to work in the prevention part to before these things happen. So on the climate resilient or climate informed health systems, the training of health professionals so they know what to do, also the governance mechanisms that need to be in place to be able to be ready, right, to respond quickly when extreme weather event occurs. And I mean, all of these processes need to go hand in hand together with having a good and withstanding infrastructure of a hospital, which is not only about the windows and the ceilings and everything, but also water that needs to continue to be running. So how to prevent the system to be cut off from water services and sanitation, from electricity getting to the hospital. So, and the accessibility of the hospital being maintained so people can get to those places. So with this very complex scenario, what are the things that you think that we should be prioritizing, how, in your experience, not only in Jamaica, but in the Caribbean, the successful stories are to share with us? Thank you.
Thank you very much, Daniel. And I'm happy to comment on that and in the context of what was presented as well, more importantly. And what I want to highlight is there's one component of the SMART assessment called the functional component that specifically looks at and gives pointers on how to ensure to build that system within the normal operations to ensure a level of readiness to respond. So it does consider the comprehensive disaster risk management perspective using the full cycle of the hazard management cycle. So for example, in Jamaica's context, and the way we do it is that we have a calendar of events every year, and we start on January of each year. For example, let's think about hurricanes, and we know the hurricane season runs from June to November every year. January of every single year, we start that process off where we look at what happened last year, what do we need to improve upon, what could we do better this year, review on if there was an event, and if not, there's at least one simulation exercise that's done every year that tests some aspect of the program, and we put that on a calendar. So everybody in the system, from national level, from regional level, from parish level, from facility level, is on that same timetable. So we have that swell of focusing on particular areas. So the first and most important thing is that it must be something that's regular, routine, and predictable. It's also very important to have a lead, and that lead doesn't have to be any particular discipline. It just has to identify a champion who knows that, for example, at this time of the year on X day, we're focusing on X, and we go into that. The best way to be able to prepare and respond is to always have it there as something that we do regularly check up on. So we have monthly disaster management committee meetings, and we discuss the issues. The SMART tool gives some key areas that you must focus on, but of course you can always add on some peculiarities that may be unique to the respective locale that you check on. In addition to that, we've clearly recognized that preventive maintenance program is absolutely critical. That is not just about the infrastructure. It speaks to the health system in general. Where are people? Who needs to be around? And what are the skill sets that's required? Prescribed action cards that are standard. So if someone starts working today, Having never been in the system before, there's a go-to to pull a set of action cards and items that's particular to you at your respective desk. And this is standard throughout, and it speaks to everybody. And if there's that regular pulse check at least once a month, which is what we do, but it could vary for different groups. So with once a month at the facility level, and we do with our health partners at least on a quarterly basis, and review the state of readiness so that in June, when we launch the hurricane season, we are also launching a state of readiness to respond as well. And all key sectors report on that evaluation, including health, as to what that needs in. And we also support that program with an established every year annual training calendar. So if last year when we responded, we recognized, for example, that we didn't have proper mechanisms to ensure power supply, we review it and we tailor the intervention and the training for that year. Because maybe it's a simple training that's required, or maybe it's just a simple reminder that's required every year. And we exercise the different elements of it. So as long as there's a structure and a program, then we can do it. We also work very, very closely with our Met Office. And so we are building on the early warning systems program. Jamaica has signed on to the early warning systems for all program, the global system. And so we are building out that mechanism. But even before that, we would have had that relationship with our key entities previously identified as the persons to signal and alert the system when we are going to be threatened. So the Met Office speaks to extreme weather events, and we have it on WhatsApp. We have our email system, and there's this blast of information that goes to all the responders, including at the facility level. So the health system comprises the infrastructure, the people, and the system that support it, and they all must participate in the process.
Excellent. I love that finishing and, all these tracks. And congratulations for putting all that in place in Jamaica and for sharing with us, Nicole. Berta, mira, tú tienes muchísimas preguntas, ¿eh? Así que te vamos a pasar.
Berta, we have lots of questions for you. So we will be sending some via email, and we have many comments. But what limitations have you seen going from what's in the plan to the actual implementation? That's a fair question, I think. Well, yes, it's very interesting. And that is what we will be presenting on October 16th. And that is a product of the assessment that we did on the Andean climate change plan. And one of the most difficult things has been that the enthusiasm with which we work on regional projects, finding agreements, giving priorities to the issues around resilient healthcare systems, recognizing the knowledges and practices of indigenous communities and rural communities. We have very interesting projects that involve lots of discussions, but then we have the management, and we have regional product funding for a regional program, and so that hasn't been as good. We haven't had as good results, and so we have come to a conclusion that we need to have stable funding for this. And one of the expected results of this plan is to have committees at border areas for healthcare ministries in our countries. It's very important to work in borders because these are living borders where the populations are integrating daily. And because of the development model that we have in Latin America and the Andean region, these are areas where a lot of problems overlap, coming from climate change, but also from the extractivism that is practiced and the inequality that it brings. And so we need to have the people that is trained, and we need for this system to address the issues. We have issues related to extreme temperatures, vector-borne diseases, and last year we had a very interesting project conducted with the International Migrations Organization on the people working with the people that live there in the borders, but there's still a lot more to do. And we also need to make progress on working on key indicators, because when we end up agreeing on the concept at the high level for an indicator, having reliable sources to have quality data, then it's not as easy when you have 6 countries, because perhaps you have 2 or 3 that say, oh yes, we have a source, but the others don't. And so the conclusion we have arrived at is that having reliable quality indicators and all of the attributes that you need for good indicators require some projects that will mean that we need to promote that in some countries that don't have those sources. And so you are all invited on the 16th to the session where we will present the results of the assessment and also the responses that the feedback we are collecting for the new plan. Thank you, Berta, so much.
A couple of questions are coming on how mental health is being incorporated in the IPCC. I think that's a topic that is growing in interest by people, by ministries, by everyone. So can you comment a little bit on that?
Yeah. So in the last assessment cycle, it was the first time that there was enough evidence available in the peer-reviewed literature to assess. So there's actually a pretty good assessment of climate change impacts on mental health and responses in the last assessment report. And in the upcoming reports, it's also a key topic. And there are authors, we're in the process of writing the report, but there are authors in Working Group 2 on impacts and adaptation and Working Group 3 on mitigation about that very topic.
Excellent. Thank you very much for sharing. Colleagues, unfortunately, we have to wrap up this session, but thank you very, very much, Sherry, Nicole, Berta, for participating today, and all of you. I mean, we had, like I said, at least 37 countries that I could count, plus an 100 plus persons participating along the session. So thank you so much. We are collecting all the comments, all the questions, and we are going to continue to circulate that to our panelists and also putting together in our report of the session. You're going to have access to all the slide decks of this session and also other information. So the recordings, as Maggie's putting now on the chat. So thank you very much. And we see each other in a few days in the session 6 of this online training course. Thank you very much and have an excellent rest of your days. Thank you.